I'm Lee Windmiller.
I'm Caylee Windmiller.
We live in St. Peters, Missouri, and lived here for about 4 years now.
Yes. So our daughter has a pre-existing condition. It is an immunodeficiency disease. Basically, she is missing the antibody that protects her digestive tract and the mucosal linings, like the nasal and respiratory.
Mm-hmm.
So basically, she's more susceptible to getting sick and can have really bad tummy issues, basically,
Mm-hmm.
stomach problems. So we started to notice at home that she would be in the bathroom a lot more, and she would be complaining of her stomach hurting terribly, crying. And so we scheduled an appointment with a gastroenterologist, and he did the full workup to see if she had celiacs. They did blood work, and she had an endoscopy done. It was negative on the celiacs, but we did find out about the autoimmune or immunodeficiency because of that. So we're grateful that we followed through with that.
At the time we were diagnosed, I worked for a hospital, and so being with it, it made it easier to get in,
having
see
the
the right,
healthcare,
having the healthcare with the hospital made it so I could.
There's no way we could have afforded
No.
doing any of that, any of those tests, the endoscopy. Yeah, without healthcare, there's no way we could have done that.
Yeah. No.
We would
Say.
have been way too far in debt.
Yeah. Say it would have.
And all the blood work and all the tests. So
Being a kid and having this, you don't really understand it. You don't know why you can't have this. You don't know why you feel like this. Being an adult and everything like that, you'd understand it, but it'd make it 10 times harder to be an adult and not be able to have coverage because you have this. I mean, it's not your fault that you have it. It's not, so having coverage is vital for our daughter to be able to get in and do what she needs to do so she can live, a relatively normal life.
And she's 7 years old, so to have a pre-existing condition and then that be used against you, and she may or may not be able to have coverage because of that, she's basically facing a life of medical uncertainty and financial.
Yeah.
And, just that's all at what? The profits of a pharmaceutical company, or it's just it's crazy that this is even an issue.
Yeah,
honestly.
they even be thought about the fact that they wouldn't cover someone just because you have health insurance, so you can be covered when you have a problem. This is Brooklyn Windmiller. She's 7 years old. She's active as can be, and she is the one we've been talking about. She has what's called IgA deficiency, and it doesn't affect her like the big problems do, but at the same time it still affects her on a day-to-day basis if you don't take care of it, if you don't stay ahead of it.
So
yeah. Tell us about yourself. Swimming?
I like to swim.
Yes, like to swim.
Climb. Play.
I think that's the main thing. Is everybody wants their kid to grow up, to dream, to be whatever it is they want to be. I just hope that we're able to do it and not have to also worry about the healthcare field as well for her, because it'd be one thing for her to grow up and pick what she wants to do with life, but at the same time, for those who can't pick their own health care due to the fact that they have pre-existing conditions, is ridiculous. So
it's almost, I feel like as if we're being picked on in a way,
mm-hmm.
because our daughter apparently isn't perfect, or she isn't in perfect health, that we're being punished for that in a way, is kind of how I feel with this lawsuit. It's not her fault. She didn't choose this. Nobody chooses this. So why would you create such a law that can negatively affect them in such a way. So I just feel picked on. I don't know how else to put that.
Yeah, I honestly say, why are you making it so? I mean, I understand because I mean you're saving healthcare money by only covering the people that are the healthiest. That way they don't have to spend money on them in the future. But at the same time, it's like this is literally what it's called. It's health care.
Mm-hmm.
I mean, they're making it to where they do not provide what they say they are providing.